Honorable Chair, we are of the view that personal respect is reflected in many aspects of our professional lives, most notably in the way we dress as well. And we are calling on our health workers in totality that we maintain professional appearance, as it is vital for establishing trust and demonstrating the respect that we owe to our patients and colleagues. That is why we are now establishing a new standard for how we dress in the workplace. We would like to remind everyone that healthcare workers and support staff are expected to adhere to a more professional and more formal dress code. The wearing of soccer jerseys, HOD, jeans, and other casual clothing will no longer be acceptable, even on the so-called casual Fridays. All our staff will have to present themselves in a manner that reflects the seriousness and respectfulness of the role that they play in the department. Furthermore, we have been receiving complaints about some staff at some clinics, CHCs and hospitals who are taking lunch breaks simultaneously, leaving patients unattended. Chairperson, I want to assure this House that we will be dealing with this matter and we will make sure that no stone is left unturned so that we address the matter. Our patients deserve the respect. We must not continue to socialize on our phones when we have our patients, and we should be treating them. So, sizokwenza sure ukuthi kuyaphela konke lokho. Siyafisa ke kodwa sesigcina uku-emphasize on this point ukuthi even ama-badge name tags, every health worker is expected to wear a name tag, and should that not happen, it's a matter that we will have to discuss with organized labor on how best do we deal with it, because if we don't do that, it means our patients will continue to get the kind of treatment that they are getting in other areas, and they are unable to complain about who actually was treating them, because that person was not wearing any name tags at all. By the way, that is a principle and policy of government, so it should not be something that we are negotiating.